The reality and the truth is that in healthcare, having a rural zip code is a risk factor for one's health and for your life expectancy.
It's a place we call home, but life in West Texas isn't always easy. There are challenges we know we need to face. We're bringing together people from different places to have a conversation about an issue that impacts all of us. We're inspiring conversations. This is Foundations.
The thing that I've seen over the years is that it just seems harder. So in smaller communities tend to have fewer people, less expertise, fewer resources. There's, in some of our communities, the population is 10,000 people, and there may be one veterinarian who is serving all of the pets that are in that community, all of the livestock, feed yards, all that need. And so that person's going to be getting called at all hours of the day and night because there's not backup. Where, if that same person did a mixed animal practice in Dallas, just outside of Dallas, for example, there would be a lot more people that they could call on. And so the day-to-day difficulty level and resources, and for me, one of my concerns is what is the mental health toll of that over time, and how are people able to deal with that? But for my experience in talking to people and learning about this is, in a lot of very simple ways, it's just harder.
I mean, to just kind of add to what Kelly said, I think it all come down to, tuition, the fund, student loan and all that. I'm looking at a student who would like to, do veterinary medicine, which is one of the most expensive courses all over the world. What's the return? Right. In the investment in going through such a degree or such a veterinary program. And that's just what people are kind of, establishing these days, just to incentivize this kind of training, provide incentive, provide scholarship to kind of drive down the cost of going to school. I mean, somebody would like to, looking at go to veterinary school, I'm probably going to go to a bigger, city to kind of get in enough return and pay back all my student loans, right, compared to somebody in the rural. But I think that's one of the biggest issue that Texas Tech School of Veterinary Medicine is kind of driving down the cost, bringing a lot of incentive, scholarship, and also the government, Texas government is doing that to bring incentive to kind of minimize and reduce the cost of education for such a degree.
Yeah, I think it is mainly, it's the money and lifestyle that really attract the young generations, especially, that they are attracted toward an urban city or urbanized city that has a lot of things to do. Not only to do, but it comes down as small as markets. What kind of market do they have? Do they have Costco or other markets that are really fun to be in? So. But then again, these are the individuals who actually pursue those kind of lifestyle without being able to earn that much money. Mm-hmm. And I think that really puts them into a risk for the future.
On the other hand, to your point about where they come from, those that we select for medical school, for veterinary school, that are from those communities, the commitment and passion they have to go back to those communities and serve those communities, regardless of how hard it is, regardless of the money. It's just really inspiring. When I talk to our students, I'm just blown away at the passion that they feel for making a difference in those communities. We see it when they interview, when they feel they know the right answer, but then we have, 2 classes that have begun through our program at this point. And, I hear the same passion from those students as they have come to our school. They're leaving and going several weeks at a time to different practices within those communities and just having amazing experiences in those places, being offered contracts, that kind of thing. So I think it takes the right kind of person, and a lot of it is that they've had those experiences before and have a realistic idea of what that's going to mean.
And I like your idea, what you described, of a holistic approach at the admissions process of deciding not just upon a person that has the highest GPA, an applicant who has the highest GPA or has the highest MCAT score, medical college admissions training score. We want to holistically look at their life experiences. You know, what are their service projects? What are their leadership abilities? What are their language speaking abilities? Do they speak Spanish? And in healthcare in Texas and in the United States, learning Spanish and knowing Spanish is really a barrier for most of our healthcare providers and for many of our patients who are Spanish speaking only. And so I think, you know, a strategy that I would recommend to the academic health centers are finding target areas, communities of need. I'll bring one up. Presidio, Texas, community of 7,000 people, down right on the Texas-Mexico border. 7,000 residents should support about 3 family physicians economically. That community has not had a physician in 20 years living in that community. For 20 years, that community has not had a physician. They've relied upon physicians to drive from Alpine, 180 miles round trip, and itinerantly provide some health care. What we should be doing is finding communities like this as an academic health center. I'm going to wear my administrative hat right now. And we should be targeting these students in middle school and high school and enabling them, empowering them with information of these are pipeline programs that Texas Tech and other health training programs have to get you in as a high school student based upon holistically who you are and where you're from and the need and your commitment to returning home to, you know, perhaps establish healthcare where there is not healthcare. You know, the reality and the truth is that in healthcare, having a rural zip code is a risk factor for one's health and for your life expectancy. We know the good news is that since 2000, age-adjusted mortality for both urban and rural populations have been declining. But what is disconcerting is that delta or that gap between the urban age-adjusted mortality and the rural age-adjusted mortality is actually widening, meaning that there's more harm to your health and potentially dying in a rural area now than in 2000. You know, that gap. We know that rural patients live less life. They live a harder life. They have more chronic pain than our urban patients do. They have higher rates of cancer. They have higher rates of cardiovascular disease, higher rates of trauma, higher rates of mental health diagnoses. And so these are things that are really the root cause is an access to care, an access to mental health care, an access to adequate nutrition, living in, you know, potentially food deserts where there's not available and affordable fresh produce perhaps in some of these literal deserts where it's hard to raise fresh produce.
Another layer of complexity that adds to that is that there is more and more deficiency in the rural area in terms of healthcare system, there is higher and higher increase in the prevalence of these chronic diseases like obesity, diabetes, neurodegenerative diseases. Now that we have an increased lifespan, generally speaking, across the board, there is people are living a little longer. And there is, it's not really, I'm not sure whether there is strongly correlated with that, but there is these individuals, and there are more individuals becoming diagnosed with, let's say, Alzheimer's disease or other neurodegenerative ones like Parkinson's. And in terms of obesity, well, in the US alone, there's a 40% people with obesity right now, 40%. That means, 4 people out of 10. They have obesity. And the thing about obesity is that itself is not really the killing factor, but that leads to many other comorbidities that are really becoming fatal. So, for example, obesity is a big risk factor for cardiovascular disease, type 2 diabetes. Type 2 diabetes actually, diabetes generally is a 7th or 8th leading cause of death in the US. Alzheimer's actually is a 7th leading cause in the U.S. So, and good thing about these is that even though we are not really sure how to treat them properly and prevent them, we have found a way, or we are finding ways to help people with these diseases from nutritional standpoint. That you don't need to really go with some pharmacological compounds or drugs that obviously is also very costly. And also you need to be on to have that effect. If you're off the drug, then you lose that effect. And also, it may have to do with some uncomfortable administration routes, right? So if we can resolve this issue from a nutritional standpoint, and I think some people many groups are coming up with different ways to have nutritional strategy or intervention to treat these diseases. And I think that could be another way that healthcare system can provide.
Can you give us an idea of, if you were talking to someone who lives in an area with limited access to food, a food desert, for example, how would you encourage them to maintain adequate nutrition that would be preventive of some of these neurodegenerative diseases?
My assumption is that as they live in the rural area, they are not making, relatively speaking, more money or much money compared to the people in the urban area.
Yeah.
And not only that, even though they have money, as you said, if there are no big supermarkets where these good producers are available.
Yeah.
And if it's to a rural area, then I was thinking of maybe there will be some kind of delivery system, but if it's too far, then the vendors would not be able to deliver those foods. Well, that's something I have to think about. Yeah.
It makes me think of a backyard garden to grow things as much as you could, and things like food dehydrators where maybe it's not fresh anymore, but you still have access to some of the nutritional benefits of fruits and that kind of thing. So I don't.
Well, one thing I can think of is probably, once in a while you'll probably drive out to the available supermarket.
Yes.
Now get some, in terms of fruits, I can think of, let's say, like blueberries, right? Those are really high in nutrition and other vitamins and minerals. Those you can buy frozen ones.
Right.
And usually those frozen ones are actually very healthy. They are ripe at the time of freezing state. So if you buy some of those, including all the vegetables or fruits, I think you can probably come back home and store those in the freezer and have that available for your meals.
Just have to take a lot of planning.
Yes, of course.
And knowledge, education as to what the needs are in terms of the nutritional needs that might be preventive for some of those diseases, but also how do you preserve foods? I mean, my sense is that people in these communities are wizards when it comes to some of these things, but they may not have all of the same access to the foods to preserve in the same ways,
or the economic ability
right.
to can or free or dehydrate. It just dawned on me, Lubbock has a healthcare catchment basin that's huge, all the way, basically between Albuquerque and Dallas, and it kind of similar. Lubbock as a catchment basin for food availability. We've got a Costco. We've got all of these great services.
It's a hub city in many ways.
Yeah,
healthcare,
that's
for
what
nutrition and education, as well, because of Texas Tech. So.
Well, and not that not that it's a negative, but something that I did find interesting is, I've done a lot of work in healthcare, and one of the physicians I spoke with, even just this last year, now that I think about it, he had this interesting theory about the donut effect that occurs out here in Lubbock, and not just Lubbock, but if you look at Abilene, it's the same way, Amarillo, where, all of our resources are just kind of smack dab in the middle right here, and everybody surrounding us has to kind of fall in to try and make it work in between. And so, I mean, that's kind of where, we are fortunate. We have Texas Tech. We have this huge hub that can provide all of that. It's just also a matter of, like you were saying, do they have the education to know what to freeze, what to get? Do they have even the way to get around to it, the transportation? There's just so much to it that, even though we see Lubbock as this, great, huge resource, there's still so many kind of questions to be answered surrounding.
And yet they have so much more knowledge than many of us do when it comes to agriculture and animal care and all of those things that we would benefit so much from their knowledge, and we could use some of that education from their communities that some of us we don't have access to, and many people don't value that knowledge in the same way.
A country boy can survive.
Yes.
I think, I was just thinking, in 1900, the average life expectancy was 47. In 2015, the average life expectancy grew 30 years to 77. But the reality is there are pockets within the United States. These are United States numbers. There are areas within the United States that have not seen that benefit in life expectancy. The Mississippi Delta region, where if you're an African American male born there, you live about an average of 9 years less than if you're born somewhere else. If you're born in Connecticut, you have a 6-year longer life expectancy than being born in some other parts of the United States. Our Native American population, higher rates of diabetes, higher rates of suicide, higher rates of substance abuse. The Texas-Mexico border, higher rates of chronic diseases. So yeah, I think we really have to plan. And as academicians, which we all are at this table and with our institutions, I think I want to tie in a hopeful message to our children, to our nieces and our nephews. We really have to decide and prioritize, do we want our life expectancy for those of us that are privileged, that can access healthcare, that live around a Texas Tech system? Do we want, over the next 40 years or 100 years, for our life expectancy to grow another 30 plus years? Or do we want to do, how can we impact those areas of pockets where there's these unjust disparities? And do we want to focus on these areas and bring the floor up of quality of life and life expectancy for those vulnerable populations? So I think the hopeful message to our younger generation, who are really going to be our healthcare leaders, our educational leaders, our government leaders, let's inspire them, let's enable them to achieve their dreams and follow their passions and follow their hearts and let their minds help solve those problems that our generation has been unable to solve. And so I think, the message to our younger generation is there's so many challenges in healthcare, in veterinary medicine, in nutrition, in journalism. But there's so much opportunity to make a difference. There's so much opportunity to do good for those living amongst us who may not have a voice or who may not have access to health care. And I'd make a point to tell every trainee that I love my job. I love what I do. I love when I get to go into a patient room and close the door and have a privileged one-on-one conversation with them and hope that I'm able to make an impact upon them. And so I would do my job as a physician. I wouldn't change my career at all. I would do it all over again if I had to. And so I think that's the hopeful message that I want to send out to our younger viewers who may be watching us, is that we need you. We need your minds, and most importantly, our patients need your hearts and your commitment to making their lives better.
I'm curious too, out here we've had, in the High Plains, I should say, we've had the hospital closures. We've also seen a lot of the downsizing of services and, like you were saying, shuttering of certain departments. And so I'm curious, that's been consistent over several years. What are the long-term impacts of that?
Yeah. Healthcare, I think we all can agree, is really one of the foundations. Education is a foundation of our communities. The healthcare system, I would think, is probably one of the also very important bedrocks and foundations that keep us healthy, keep our public health good and vital and sustainable and growing. But then, also it relates to economics. And, those workers, there's no healthcare in Koyanosa. It's 45 miles away. And so if one of those workers has heat stroke or heat exhaustion, that goes to cardiac arrest, that nearest EMS unit, the nearest ambulance is 45 miles away. So that's a risk factor for their health. But then where do they go when they just need to get their preventative checkups, their vaccines, get tested for diabetes so that you can impact their health preventatively before it becomes a crisis and they show up in the emergency room really, really sick? Well, it's also 45 miles away. And that's one of the things that we've realized, I think, with COVID and telehealth is that we have to get away from practicing medicine within the walls of a clinic or within the walls of our hospitals, and we have to meet the patients where they are, whether that's via telehealth or whether that's through mobile clinics, moving into these isolated communities and providing some sort of point of care, access for these isolated communities.
The tuberculosis in dairy cattle and in the migrant workers that work at the dairies, that's a big problem recently. And One Health, that One Health concept approach is relative to what you're talking about.
Yeah, I read about that story. I also read about it. I guess that's one of, the drivers we're talking about in terms of what some of the factors that kind of drive this one issue. And that's the, migration is part of it. You have things like that. And looking at tuberculosis, yeah, it can go either direction, either from the humans to animals and also from animals to humans. So, and today, people talk about the complex itself because it's just, becoming intertwined. You can't really separate what direction it's actually coming from. So it becomes some kind of bi-direction transmission of disease, with that aspect of the tuberculosis, bacteria itself. And I think that's, that's one of it. That's one of it, bringing human in contact, as per occupational exposure, migration itself, people moving here and there. Today we say the world is a global village. Whether you're coming through, whatever route you're going through, there's always that risk of, transmission of disease from different areas. I remember one day I was coming from Colorado to Amarillo, and, one of the flies enter into the plane, and we took it from Colorado here. I was, I'm looking at, okay, yeah, that's it. So people talk about transmission of disease.
I don't know, travel to particularly African countries and South American developing countries. In the past, they would come on and the flight attendants would walk up and down the aisles with insecticide and disinfect the plane before it landed so that they wouldn't bring mosquitoes in. And I mentioned that. If you are familiar with the recent cases of locally transmitted malaria, 4 in Florida, 1 in Texas, all of that's coming together. We're seeing more of that. We saw Zika and chikungunya years ago when mosquitoes and then people into Texas, but the imported cases of those kind of diseases, I think is going to increase because there's not a focus on it. But then from the human medicine side, the awareness, those kind of diseases haven't been a major issue in the United States for generations. And so there's not, medical students aren't learning about infectious diseases, the vector-borne kind of infectious diseases that previous generations learned about. And I know veterinary medicine, as far as I don't know how much is taught at the School of Veterinary Medicine at Tech, but I've had a lot of conversations with Jason, and you've been in some of those conversations, Bubba Phillip, that, getting back to understanding that those diseases do those pathogens do exist in nature and can be transmitted to humans, and we've just had great control of it up until recently.
I know most of our discussion have been on rural and WANET in general, especially in Texas Panhandle. So I would say one of the, in addition to the veterinary training as well as education being established by Texas Tech, so the School of Veterinary Medicine in Amarillo have an established, PhD in WANET science, which is one of a kind in United States, to train the next generation of researchers of individuals that will meet the needs, based on what we've really highlighted, whether it's, chronic diseases, whether it's infectious disease, or whether it's, suicide, as the case may be, and also the training of the next generation, scientists. So it's a new program, about 2 years right now, and we're really happy. We have a lot of students, and we believe, some of this, we mentioned a lot about, education, catching them young, not only just catching them young and, pushing them into the training, but also to kind of keep them, as they go on in their training. And that's something great that our School of Veterinary Medicine, is doing, is to train the next generation of WANET scientists.
Is it a PhD while they're getting their DVM?
Oh, that's separate.
It's completely separate.
Yeah, completely separate. So we don't currently have a dual program, but I don't know, maybe that would be something that will come up down the road. But currently we have separate DVM and also separate PhD WANET science program.
Interesting. One of the things that Texas Tech is trying to do is we're trying to get out into these rural schools, beginning at the middle school level, and trying to encourage them to talk about all sorts of healthcare careers and how they can benefit their community. Many of these students are interested in agriculture, and we're trying to talk to them about one way that you can contribute to agriculture is by going into healthcare, becoming a rural nurse, becoming a rural physician, a rural behavioral health provider, and taking care of that ag producer, that livestock producer, and keeping them healthy so we can keep the food, fiber, and cotton and gas pumping and going for our country. So that is one thing. And then Texas Tech recently has also opened up several rural family medicine residencies out in the Permian Basin and the Big Bend, where these family medicine residents spend their final 2 years of training in an under-resourced rural community, where that's where they kind of grow up professionally and learn to practice without all of the labs and consultants that are available in a large hospital.
We are trying to understand the underlying mechanisms by which obesity develops, or diabetes, or Alzheimer's disease develops. And obviously, as we just discussed so far, these are all chronic diseases that is just increasing its prevalence throughout the world, especially in the U.S., especially in the rural areas. So for obesity and diabetes, those are quite very linked together. We are trying to understand what diet, does it matter with composition? Was it really high carb diet or high fat diet? Or is it really a third one, which is ultra processed diet? So that will be the equivalent to the people who are in the food desert going to the gas station and getting this highly processed, a lot of times high-calorie food items. Trying to understand the neural mechanism versus hormonal mechanisms. How can we find out the pathway to which we can, for that can be used as a reference point for us to for doctors to be able to diagnose properly whether this person has a dysfunction at this node of process, or this process of the disease progress, and so on. In terms of Alzheimer's disease, again, the number is going up. Trying to understand different pathologies that's happening in the brain and how we can mitigate those pathologies or slow down that disease progression by mainly either pharmacologically or, better yet, nutritionally. So that's what I'm doing.
One of the things that brings me great hope, I see in the everyday of my job, which is that more and more of our young people are aware of mental health, value mental health, and when they're struggling with their mental health, they're asking for help. When I began at the vet school, one of the concerns I had was that given the limited prior exposure to behavioral health, mental health, psychologists, therapists in many of the smaller communities that people came from, that they would be reluctant to come and talk to me when they had difficulties because of stigma related to mental health. And I think we've done a really good job of addressing that with our students and educating them from orientation on about the importance of their mental health and the availability of services in our school. And over the last 2 years, I've seen more than a third, almost a half of the students in our 2 classes so far. Thankfully, a lot of the times it's very simple issues, a struggle with getting along with someone or struggling with anxiety related to taking exams, needing some counseling related to study strategies, those kinds of things. But they come to me and they ask for help, and that gives me great hope for the future in terms of them being able to model that in their communities. They'll have knowledge of what does it look like when someone's really anxious. We have taught them some signs of suicide risk so that as they are providing services to highly distressed clients in the future, they're aware of what are some of the resources that they can provide to those people. So that gives me great hope for our future.
Well, for me, working with the Texas Tech School of Veterinary Medicine, working with other faculties to achieve and staff to achieve the common goal of, providing or raising the next generation of rural and regional veterinarians that meet the need of this, location in Texas. So that's something really inspiring, and we're seeing, them day to day achieving that aim, growing up, learning to be who they want to be, and what's the focus and the plan of the college is. So that's really inspiring, and I've seen the prosperity of the college, in terms of the product, in terms of the student they are training and bringing forward to go into the community to achieve that is really inspiring for me. So been there for about 2.5 years right now. I've seen a lot of progress. I've seen a lot of, development. I've seen a lot of passion in the leadership and also in the enthusiasm in the student to really, come on board to achieve those goals. This is really inspiring. And, I look into the future and I see that, the purpose of establishing the veterinary college here in Amarillo is really going to be prosperous, economically, and also build the needs of this community in terms of the shortage of rural and regional veterinarians within this area.
My passion, and I've learned more and more throughout my career, and I've been doing this a long time, but I kind of followed my passion, and it's led me. Teaching the next generation. It's not just teaching the class, the lecture, but it's actually engaging undergraduates and graduate students into the laboratory and watch their expression and how they get a passion for arthropod-borne diseases, whether it's mosquitoes or ticks, or like this morning, I was out with a group looking at fleas from prairie dogs. And, a lot of these students, the graduate students and undergraduates as well, have never been exposed to, or never realized, they knew about fleas, they knew about ticks, or they knew about mosquitoes, but they really didn't know about them. They didn't know that they could transmit disease, that they're prevalent everywhere. So just that passion of watching a student, whether a graduate student doing research or whatever, when they get it, you can see it on their face when they get it, and then watching that passion grows over the next year or two, that is the greatest reward. So you mentioned, Adrian, you loved your job. I do too. Sometimes it's good, sometimes it's bad, but it is what it is. But at the end of the day, there's really nothing better than knowing that what you do, but for me anyway, actually has a positive impact, a positive influence on not just another individual, but on a community, whether, it's contributing to public health, and that I'm including veterinary health in the public health perspective, because, with horses, again, West Nile virus, which is on everybody's mind right now, horses, if you have horses, it's going to affect them, and the vulnerable human population, especially those with comorbidities that obesity, they're susceptible. Anyway, I'm getting off target there, but that's just one of that gives me fulfillment at the end of the day. And when I look back at the end of the semester, I might be tired and worn out from field work, or research or teaching or whatever. But when you have a former student call you and they're applying for an academic position at some other university or to medical school or to veterinary school and ask you to write a letter, that kind of seals it for me. Hey, I helped create or I helped educate that next contributor that will take my place.
That's a legacy.
Yeah.
Yeah, an impact and a legacy. Yeah.
With my work, I try to focus a lot on the rural communities that, do have needs that need to be addressed and kind of bringing that awareness there. But, something that I think, I even probably undersell myself is like truly rural lifestyle is pretty amazing. The small town friendliness, the knowing who your neighbors are and being able to chat with them. I think it's something that is very charming that, I didn't appreciate whenever I was younger, but as I've gotten older and even as I've gotten to talk with people in rural communities all across Texas, I've really started to appreciate that and appreciate the true kind of, the love thy neighbor aspect that comes out of those communities. And I think that's something that, even with everything we've talked about today, there is that big, meaningful sentiment for all of them, really. None of them are ready to leave their towns. They're there. That's their home. They love it. They want to stay. They want to make it better. A lot of situations, like Adrian was saying, where you have people who were raised out there and they come back to make it better. And, I think that's something that's an incredible spirit that you really only find in those rural small towns.
And Jamie, I'm proud of your work. In journalism, you give a voice and you give a voice to those who don't have a voice often. And you amplify the advocacy that we're trying to do for our vulnerable populations. And so your impact through your commitment and your dedication to rural journalism, I've admired for many, many years. And I thank you for that, because you're part of our healthcare system, because you tell our patient stories and our clinician challenges and stories that we have. So thank you for the work that you do.
Thank you. I appreciate that.
My sense of hope comes from community and feeling a sense of belonging, just as I feel a sense of community with you all now. The inspiration and the hope that you all have given me today is knowing that you all are interested in rural populations as well. Every one of us at this table is. And one of the quotes that I like to use a lot is from one of my virtual mentors who unfortunately passed away. I didn't get a chance to meet him in person, but Dr. Paul Farmer. Is this quote that I really, really love of, "Our most significant professional accomplishments in life will be done in partnership as a team, essentially as a community." And what warms my heart and gives me hope is that I do feel that this Texas Tech system is committed to partnering with rural populations in education and healthcare and veterinary medicine and behavioral health and nutrition, and partnering and accompanying these rural communities and these rural citizens on their challenges and trying to solve those, help them solve those challenges. So that gives me hope. And then all the students who come and make me a better physician and I learn from them and hope that I've taught them something, but just the inspiration from that younger generation, seeing the hope and the enthusiasm and the fire in their hearts and minds really give me a lot of sense of inspiration that I don't think I ever want to retire from this work. There's too much work to be done.